time is not about that, but it's about the
to ensure the safety and health of all people on board, while also limiting further spread. WHO has...
We do believe that there may be some human-to-human transmission that's happening among the really close contacts, the husband and wife, people who've shared cabins, etc. So again, our assumption is that has happened, and that's why we are operating and working with the ship to make sure that anyone who is symptomatic, anyone caring for patients is wearing full personal protective equipment. The medical personnel who have boarded the boat have brought additional PPE as well. So that's our working assumption. But just again, contextually, hantaviruses don't typically transmit that way. It's really a rodent infection.
Viewers, you've heard about these days. You start immediately or you...
No, fine.
Sequencing is underway by NICD in South Africa. We're hoping to get those results as soon as possible. We were hoping this morning, but they're working very hard on it, so perhaps tomorrow. We are working under the assumption that it's the Andes virus, so from a precautionary point of view, we feel that this is the best approach to make sure that we have the right precautions in place.
How long does the process take to get results? And
the initial patient, the initial case, and his wife, they joined the boat in Argentina. And with the timing of the incubation period of hantavirus, which can be anywhere from 1 to 6 weeks, our assumption is that they were infected off the ship, perhaps doing some activities there.
I see you nodding, so that's a yes. That was an easy one. The second question is more on...
Based on the current information and what we know about previous outbreaks, WHO assesses the overall risk to the public as low.
We will provide any updates as necessary.
Thank you very much.
Just to say, it's not just the people who are on the ship that, of course, we are concerned about. We're also working with authorities for anyone that has left the boat, the ship, I was told to say ship, that has left the ship in different ports along the cruise.
Things to different people, but just to say that's really among very close contacts.
Right now, the ship is off the coast of Cabo Verde. The plan is, and our highest priority is to medically evacuate these 2 individuals to make sure that they have the care that they receive. So the plan, that is currently in the works, it's underway. The plan now is for the ship to continue on to the Canary Islands. We're working with Spanish authorities who will welcome the ship, have said that they will welcome the ship, to do a full investigation, a full epidemiologic investigation, full disinfection of the ship, and of course to assess the risk of the passengers that are actually on board. As I said, there are no other symptomatic patients who are on board. So that is planned. So once the 2 sick individuals on board are medically evacuated, then the ship can move.
That actually in all different types of settings. So that is underway. I don't have any feedback on that right now.
We are deeply troubled by the worsening human rights situation across Mali, following coordinated large-scale attacks by armed groups on several cities and towns on the 25th and 26th of April.